Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today, you're going to learn about geriatric care. My guest today is Dr. Usman Khan, the Director of Geriatric Medicine at Glen Cove Hospital, which is a part of Northwell Health system. Glen Cove Hospital has established itself as a Geriatric Center of Excellence and is currently the only hospital in New York State to earn the top accreditation for emergency department care for the geriatric population. Dr. Khan, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome to our show.
Thank you for having me.
I just want to start by asking you, what made you choose this career path in geriatric care?
So for me, it was more of a personal, close history with care for the older population. My uncle actually had Parkinson's, and with the years, it progressed. And he ended up developing terminal advanced dementia. And so throughout my high school as well as undergraduate years, my cousin as well as myself, we would always be in and out of the hospital, taking care of him, taking him to his doctor visits, over at nighttime, any complications that he ended up having. And that's the medical aspect of it. But I really did get to appreciate, the providers, the doctors that were caring for him. They always wanted to care for him as a person and not just a diagnosis. And that, to me, I didn't really appreciate with any other specialties. And so for that reason, I wanted to get into medicine for the reasons that you want to care for the person as opposed to anything else. And I really appreciated that with geriatrics.
Yeah, what a great career path that is. So how would you define the geriatric population in terms of age?
Geriatric population by age is defined as anyone older than or equal to 65 years of age. 65
and older. Has that changed over the years now that we've seen people live longer?
It's actually, initially, people used to, the lifespan was lower than that. Mm-hmm. But with the advancement of technology and medicine, we've noticed that the average age is around 70 to 80. And so because of that reason, the age has changed to 65. Yeah. Will it change later on in the future? I suspect, maybe it would probably become a geriatric population to be maybe around 70 years of age, as opposed to 65.
How does that perception affect patients who may come to you and seek out geriatric care? Would you say that your average age is 60 in the sixth decade of life, or would you say it's older, the average patient that you provide care for?
I would say it's older. It's funny. Whenever we actually, I don't practice in an outpatient facility, mm-hmm. but during my training, when I was practicing in the office, in the clinics, it was funny. Anytime we had somebody that was 65 years of age, we would joke with the patient and their family that, "Oh, you're a baby," because you're very young for a geriatric. Right. So the average age that we usually would see in the practice would be around 70 to 80, and in the hospital setting, that's pretty much what I would say around here as well. The average age that we're noticing people are between the ages of 70 to high 80s. And there are definitely a lot of people that we are also seeing admit in the hospital that are in their 90s mm-hmm. as well.
Are you seeing many centenarians in the hundreds?
We've had a few. We've
Okay.
had a few definitely that were
Awesome.
in their hundreds.
Hmm.
I would say maybe in their like 101, 102. The
Wow.
oldest person that I've ever treated was 104. That was
Nice.
the oldest person that I've ever treated.
So it's very interesting that Glen Cove is pretty much the only geriatric center. Is that on Long Island or in the state?
Out of Northwell hospitals,
Okay.
we've defined ourselves as out of the Northwell facilities, Glen Cove Hospital being the center of excellence for
Hmm.
geriatric care
Okay.
of our facilities. I can't say that we're these Geriatric Center of Excellence for the state or even for Nassau County, but we've defined ourselves that we would provide the utmost care, and we focus on our older population and the care that's surrounding them over here at the hospital, at Glen Cove Hospital.
So since you have been identified as being sort of like the excellence in terms of geriatric care, how does that differ from any other population of people, the young adult or the adolescent? What are you doing as a geriatric center that makes you different and unique?
So the care is not different that you would provide to an adolescent or a relatively younger adult. You want to provide the care throughout the spectrum. You want to provide compassion. You want to provide respect and listen to your patients. We provide all that. When it comes to being a center of excellence, we are not only talking about medical aspect of care, but we are talking about the social aspect. We're talking about the physical building itself, and like the renovations that we've done in the emergency room and we're doing on the medical floors that are more safe and not a hazard to our older population. So we've actually taking into even minor details as the setting of our lights, the tone of the lighting or the color of the paint, the flooring that we make it so that it's safe for them to prevent them from a fall, or if God forbid they do have a fall, it's not injurious to them.
So I know the Glen Cove Hospital offers outpatient primary care, community resources, emergency, inpatient hospital care, specialized hospital programs, at-home services, long-term care, skilled care, and end-of-life care. All of these make you a center of excellence. I know that's a lot of services, but can you go into more detail? You talked about just having your facility meeting the needs of the motor changes and maybe the sensory changes of the older adult. What else do you do to provide maybe emotional or the psychological needs of the patient and or their family?
So caring for an older person is equivalent to a new parent that has no experience taking care of a newborn. It can be overwhelming, it can be stressful, and it can take a toll on the person themselves, which sometimes it's the caregiver's guilt itself. They feel guilty for feeling such a way, for providing care to their loved one. We've actually developed a caregiver center at our hospital that is more so providing any kind of support that the caregiver themselves will need. The hospital itself is providing support and care to the patient, to our older population, but it's those caregivers, the family members, the loved ones that actually also need support and care. And so we've built a caregiver center in our hospital that we identify the loved ones, and by our social workers, our case managers, our providers, our hospitalists, and so forth, our palliative team. And we actually can sit down with them over there and just let them talk about what their concerns are, what kind of support they need, whether it's from the hospital or from the community. And we have strong ties with the Glen Cove community itself. It's not just a hospital that is running independently. It's support from the long-term the assisted living facilities, from the nursing and rehabilitation facilities, as well as the Glen Cove Senior Center as well, that provide us with any kind of support that we need. And we actually provide that to to the caregivers and the family members of our patients. The development of our caregiver center has been a huge it's been a huge success in providing care to our caregivers.
Well, that sounds like a very collaborative practice, and certainly offering resources to the older adult and their loved ones is so important. Let me move on a little bit to more of the expectations that we can expect to have or see when we go for a clinical visit. What should I, as an older adult, be concerned with my blood work? If I'm going to see a physician, am I expecting that they take a certain blood work from me to look at as I age?
As we age, as we get older, our bodies, certainly there are changes that occur physically to our body, as well as our organs itself. In general speaking, the changes that occur in our body does cause sometimes a decline in some of our organ function. More specifically, looking at the heart, looking at the kidneys, even our thyroid glands as well. They can also be noted to have some dysfunction. This is not to say that it occurs with every older person, that this occurs with everyone. But in general, it's always good to have a close monitoring of your kidney function, of your electrolytes, to ensure that you're maintaining a good balance of your water intake as well as your food intake, where you're getting the electrolytes from. And because of the reason that as we get older, our heart can, the function of our heart may not be as optimal as it was when we were younger. That can affect our ability to retain fluid or be able to urinate excess fluid, which can cause us to develop swelling of our legs and even difficulty breathing as well. So I can't say that it's guideline recommended or standardized that they have certain testing done, but usually your provider would want to do a panel of blood work that would ensure that your kidney function, your organ function, your thyroid glands are functioning properly.
So that's good to know when I go to see a physician, that they're not only doing that head-to-toe assessment, but that they are taking bloods that would reflect the functioning of my organs. Are there any vaccines that I would need to be aware of as an older adult?
Usually we follow the same recommendations from CDC as far as the scheduling for vaccines. The one vaccine that is recommended to take part of when you are 65 or older is the pneumococcal vaccine. Now, they have come out with Prevnar 13 and 23 in the past, where it was recommended to follow appropriate scheduling. They recently come out with a different dosage of it, which is 15 and 20. And so depending on how you're scheduled, or if you've received it, you should definitely follow up with your primary doctor to see if you are considered a candidate for the pneumococcal vaccines, and whether you are 60 years of age or 65 or older, if you are a candidate to get that.
So talk to me about colonoscopy and possibly mammographies and all those kinds of other diagnostic tests that I need to be aware of.
Those routine screening for cancer usually actually starts off at an earlier age. So you mentioned colonoscopy. It's recommended for people that are without risk in the general population to start having colonoscopies at the age of 45 and continue, if it's normal findings, to continue to have it once every 10 years. If you continue to have normal findings with every colonoscopy, the recommendations are you don't need to have one after the age of 75 to 85. It's usually recommended at that time that you can stop doing so. The other, as far as, you mentioned the mammography, again, that's also recommended to start off screening at the age of 40 at an earlier age. And it's something that's recommended to continue on once a year. Again, it's usually when you get older at the age of 70 to 75, we do recommend that there's no need to continue performing that. Again, that's something that you should, follow with your primary doctor to see if you are considered safe to stop performing these routine screenings.
So should I, as an older adult who is aging, become more frequent in my physician visits or healthcare physicals as I age?
As we age, seeing your healthcare provider once a year would be for a routine annual physical is appropriate. As we discussed, if you do have certain decline in functioning, if you do have certain decline in your development of like organ dysfunction, or there are some certain chronic diagnoses that require more frequent visits, then it is recommended that you do see your provider on a more routine basis. It doesn't have to be every week or once a month, but it is recommended that you should follow up maybe 3 to 6 months if you have certain conditions that need a closer monitoring. Mm-hmm. And it doesn't necessarily also have to be with your primary doctor. It could be with a specialist. For example, if you have a condition of heart failure, which is a common thing that can occur as we get older, our cardiac function can decline. It is recommended that you do see a cardiologist once every 6 months or more frequent depending on the severity of your condition. Same thing with if you have lung disease, you may want to follow with your pulmonologist more frequently than on a once a year basis.
So it can be quite daunting to keep up with a cardiologist, a nephrologist, a pulmonologist, and all these specialty doctors in addition to my primary care physician. How do you suggest I negotiate that, especially if those specialists are not communicating with each other? It tends to be the care becomes very fragmented. How do you suggest that I keep them all on the same page with each other's care and still keep up with my primary care physician? How do I manage that as an older adult?
So it's difficult. It's certainly difficult, and it's a hard task on the person themselves as well as their caregivers to be able to balance these office visits as well as visits with the specialist. As a geriatrician, I would recommend that you should see a geriatric specialist as well, because just like a primary care provider, a geriatrician also makes sure that we're caring for the person as a whole, as opposed to caring for certain diagnoses. Yes, of course, if you have a cardiac condition, you do follow the cardiologist. But as a geriatrician, we want to make sure that, the medications that they're getting, we're communicating with the cardiologist our concerns or our recommendations, and also seeing what the other specialists are also recommending. So having a good primary care and a good geriatrician does help out, because they can be that bridge to ensure that there's ongoing communication with the specialist, as well as with the person themselves and their family. It also helps out if, you have care with providers in the same health system, so that they can communicate and also be able to directly see what the recommendations are in the electronic medical record.
That's a good point. So if I go to all Northwell physicians, they can read the chart and see what everyone else is doing, the cardiologist, the pulmonologist, and everybody can kind of talk on the same level and collaboratively. Is that right?
Yes. There are many times that we actually, to ensure that we have continuity of care and the best care for our patients, we ensure that, once the patient leaves the hospital or leaves their practice and goes home, we're able to communicate with the specialist afterwards directly through phone and let them know or be aware that their patient is leaving the hospital, that they were under our care. And these are the things that need to be followed up with. Mm-hmm. And so the primary care or the geriatrician can continue to follow that and also communicate with their specialist as well directly through the phone.
So just to clarify, the primary care physician and the geriatric physician are one and the same, or should I have both the primary care physician and the geriatric physician?
Geriatric care can also be provided. The primary care can also be provided by a geriatrician.
Okay.
The role of a geriatrician, which I recommend to be seen by, or rather every person over the age of 65 should be seen by a geriatrician, mm-hmm. because we tend to make sure that we're treating the person as a whole. We're not focusing on certain diagnoses or certain medical conditions. There are many times that, if a person has a diagnosis of, for example, cancer, mm-hmm. the oncologist is going to focus on making sure that we can treat the cancer. But have we taken time to actually talk to the family or the patient themselves about what matters most to them? Mm-hmm. And that's where the geriatrician makes sure that we're able to, see that what the person what their needs are, what their wishes are. And we can, abide by those wishes and make sure that they're getting the care that they would want.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about geriatric care. My guest today is Dr. Usman Khan, the Director of Geriatric Medicine at Glen Cove Hospital, which is a part of Northwell Health system. Glen Cove Hospital has established itself as a Geriatric Center of Excellence and is currently the only hospital in New York State to earn the top accreditation for emergency department care for geriatric care. So I just want to take this conversation to long-term skilled care. So long-term skilled care is defined as what? And who's eligible?
So long-term skilled care is basically what we're referring to is if you need what we consider as assisted living facilities, mm-hmm. we consider as our nursing homes. Those are facilities that can provide you with care for not only your chronic medical conditions, but also care for if you have functional decline and need additional support for your day-to-day activities, as well as your activities for daily living, as well as the activities that you would need for that you were independent. Who would be considered a candidate for it is not more so dependent on just your age, but it's also dependent on your social situation. There are many times where our older population, a person may be highly functional at home, independent, but due to unfortunate events of some kind of either trauma or some sort of medical condition that can that cause them to be dependent on needing assistance for activities as well as for their own care. And because of the situation, maybe they don't have any support from, family because they're not nearby. They may be candidates for, residence at an assisted living facility or even at a nursing home for long term.
So there are levels of skilled care. So in a skilled care facility, would that mean that I would be able to get medical interventions and nursing assistance in these skilled care facilities?
Yes.
Okay.
So skilled nursing facilities would provide you with medical intervention if you have any kind of medical needs for management of your medical conditions, as well as 24-hour nursing support as well.
And to that, another branch of the geriatric care facility that you provide, that you're a part of, you mentioned something about end-of-life care. Is that a part of this geriatric care?
That actually plays a huge part because we want to be able to have the conversations of what matters most to the person. We want to have that conversation to have them feel comfortable expressing what their wishes are. End of life is, it goes under the umbrella of our goals of care conversation. And so we want everybody to be able to communicate with their loved ones, with their providers, their primary care providers, their providers, whether they're in the hospital or in an assisted living or a nursing home facility. We want people to provide their wishes as far as what kind of care they want. Do they want to be resuscitated? Do they want CPR to be done? Do they want to be mechanically ventilated? Do they want to have a feeding tube if they are unable to eat by their mouth? Do they want those kind of care? And that goals of care conversation lets us know what your wishes are. And so with that, we can provide the kind of care that you would want. End of life, when we talk about that specific terminology, end of life, we're talking more around the fact of hospice. And so hospice does fall under the umbrella of geriatric care and even under the umbrella of palliative care. And so that goes hand in hand with the same goals of care conversation and what matters to the patient and their family. What do they want their end of life to be?
Thank you for being here, Dr. Usman Khan, the Director of Geriatric Medicine at Glen Cove Hospital, which is a part of the Northwell Health system. We hope you stay safe and continue to stay healthy and continue to do your great work.
Thank you so much. Thank you for having me again.
You're welcome. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.